Have you ever heard of Osgood Schlatter disease? It's a name that might sound daunting, but in reality, it's a common condition that often affects the knees of pre-adolescent children during their growth spurts. Imagine the patellar tendon, the cord-like tissue that connects the kneecap to the shin bone, being tugged on repeatedly. This continuous pulling is the root cause of Osgood Schlatter disease. Now, picture a young athlete, maybe a basketball player leaping for a dunk, or a soccer player sprinting down the field. These high-impact activities involving running and jumping are often culprits, making athletes more susceptible to this condition. It's worth mentioning that while Osgood Schlatter disease is most common in active children and adolescents, it can really occur in anyone experiencing a rapid phase of growth. Now that we know what Osgood Schlatter disease is, let's dive deeper into its causes and symptoms. So what exactly causes Osgood Schlatter disease? Well, it's all about growth and activity. This condition often rears its head during the rapid growth spurts of pre-adolescence, when bones, muscles, and tendons are changing and stretching to accommodate a growing body. Now, let's focus on a key player in this scenario, the patellar tendon. This is the tough band of fibrous tissue that attaches the bottom of the kneecap to the top of the shin bone. When a child is active, especially in sports that involve a lot of running, jumping, or bending, the patellar tendon pulls on the growth plate at the top of the shin bone. This repeated stress can cause inflammation and swelling, leading to the characteristic pain of Osgood Schlatter disease. In simple terms, the disease is caused by the constant tugging of the patellar tendon on the growth plate at the top of the shin bone. It's like a game of tug-of-war with the growth plate and the patellar tendon on opposite sides. The more the child runs, jumps, or bends their knees, the more intense the game gets. Eventually, the growth plate may start to hurt, and that's when we see the symptoms of Osgood Schlatter disease. So it's not surprising that this condition is more common in young athletes, who are often pushing their growing bodies to the limit. However, it's important to note that any child going through a growth spurt can develop Osgood Schlatter disease, even if they're not heavily involved in sports. Understanding the causes of this disease is crucial, but recognizing its symptoms is equally important. What signs should you look out for to identify Osgood Schlatter disease? You might ask. The key indicators of Osgood Schlatter disease are pain and swelling, typically located just below the knee. This discomfort is not a constant companion, but rather a fair-weather friend that shows up when you're on the move. Imagine you're a young athlete. You're in the middle of a football match, or perhaps you're sailing over hurdles on the track. Suddenly, you feel a sharp pain beneath your knee, like a stitch in your side, but far more persistent. That's your first clue. As you continue to engage in high-impact activities like running or jumping, the pain may intensify. It's as if your knee is sending you a distress signal asking for a break. This is because the stress from these activities can exacerbate the inflammation caused by Osgood Schlatter disease. Now, it's not just about pain. Osgood Schlatter disease also comes with swelling. This can appear as a noticeable bump just below your knee, where the patellar tendon attaches to the shin bone. It's like your body is adding a physical marker to highlight the source of your discomfort. But don't be alarmed. These symptoms, although uncomfortable, are part of your body's natural response to the overuse and stress on the growth plate at the top of your shin bone. It's your body's way of saying, "Hey, slow down, I'm still growing here." So, if you're experiencing persistent pain and swelling below the knee, especially during or after rigorous activities, it's worth considering Osgood Schlatter disease as a possible explanation. Remember, this condition typically shows up during growth spurts, so age and activity level are important factors to consider. Now that we know the symptoms, let's talk about the effects of this disease. So, what happens when you have Osgood Schlatter disease? Well, it's not a life sentence, and it's important to remember that it often resolves with time. Your body is amazing at healing itself, especially when you're young and still growing. One common effect of Osgood Schlatter disease is the development of a painless bump just below the knee. This bump is the result of your body's inflammation response, and while it may seem a bit odd, it's completely harmless and typically doesn't interfere with any activities you enjoy. In some cases, adults who had Osgood Schlatter disease as children may experience occasional knee pain. It's a lingering reminder of those growth spurts during puberty. But don't be alarmed, this occasional discomfort is usually manageable and doesn't mean the condition has returned. Remember, Osgood Schlatter disease is a temporary hurdle, a part of growing up for many young athletes. It can be uncomfortable, yes, but it's not insurmountable. The effects of this disease can be managed, and now we'll discuss how. So, how can Osgood Schlatter disease be treated? That's the question on everyone's mind after learning about this common condition affecting young athletes. The good news is, treatment is often straightforward and primarily focused on managing pain and modifying activity levels. First and foremost, it's important to understand that the goal of treatment is not to cure the condition, but to manage the symptoms. This is because Osgood Schlatter disease generally resolves on its own once the growth spurt ends. Managing pain is a crucial aspect of treatment. This can be achieved through a variety of means. One common method is the use of ice packs. Applying an ice pack to the knee can help reduce both inflammation and pain. This is typically recommended for 15 to 20 minutes at a time, several times a day, especially after physical activity. Medication can also play a key role in pain management. Over-the-counter non-steroidal anti-inflammatory drugs, often referred to as NSAIDs, can be effective in reducing pain and swelling. However, it's always important to consult with a healthcare provider before starting any medication regimen. Activity restriction is another significant aspect of treatment. This doesn't mean that young athletes need to completely stop all physical activity, but rather they should avoid activities that exacerbate the pain, such as running and jumping. In many cases, a period of rest can be beneficial. Physical therapy exercises can also be employed to strengthen the muscles around the knee, helping to stabilize the area and reduce strain on the growth plate. This can include quadriceps and hamstring stretches, as well as exercises to improve balance and flexibility. While it might sound daunting, surgery is rarely necessary for Osgood Schlatter disease. It's typically reserved for severe cases where conservative treatments have failed, and the condition is causing significant impairment. Remember, early recognition and appropriate management of Osgood Schlatter disease can lead to a quicker recovery and return to play. Let's summarize what we've learned about Osgood Schlatter disease. This condition, often seen during pre-adolescent growth spurts, is characterized by pain and swelling just below the knee. It's typically caused by the pulling of the patellar tendon, making it particularly prevalent among young athletes involved in high-impact activities like running and jumping. Symptoms can include discomfort and inflammation below the kneecap, often exacerbated by physical activity. If you or someone you know is experiencing these signs, it's important to seek a professional diagnosis, which usually involves a physical examination and, in some cases, imaging tests. The effects of Osgood Schlatter disease are usually temporary, often resolving once the individual's growth plate stops growing. However, it's crucial to manage the condition effectively to avoid potential long-term impacts. The primary treatment focuses on managing pain and limiting activities that exacerbate the condition. Rest, ice, and pain medication are often recommended, along with exercises to strengthen the surrounding muscles. Surgery is rarely required and is generally considered only if the pain persists despite other interventions. Stay active, stay safe, and keep an eye out for the signs of Osgood Schlatter disease. Until next time, take care.